sponsored by the Carpal RX. If your hand and fingers are making it difficult for you to work, you might have carpal tunnel syndrome. The symptoms include pain in the hand and fingers, and also might include numbness and tingling. Some people wake up in the middle of the night to shake out their numb hands. And if you have carpal tunnel syndrome, chances are a close relative, like a parent, has also had it. In fact, the National Institutes of Health says that genetics or family history is among the most reliable predictive factors in having carpal tunnel syndrome. But what is carpal tunnel syndrome? It's actually a disease that begins deep inside the wrist, inside a confined area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, the sheath begins to swell, and that pushes against the median nerve, and that causes the pain and other symptoms of carpal tunnel syndrome. Nobody is really sure why this condition is tied to genetics. It might have something to do with carrying the genes for small wrist size, which is one known risk factor. Or it might have to do with carrying a gene for defective collagen, which makes tendons more brittle and easier to injure. So while genetics definitely plays an important role, what can be done to treat this painful and often debilitating condition? If you're thinking about having surgery for your carpal tunnel syndrome, discuss with your doctor the fact that most people are dissatisfied with their surgical results, while the overwhelming majority of people who use non-surgical therapy are very satisfied with their results. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapies that everyone should use start with resting your hand, splinting your hand while you sleep or night splinting, and deep tissue massage. In fact, deep tissue massage is nearly 100% effective in relieving carpal tunnel syndrome, but only if it's done daily and for a period of 2 to 4 weeks. But this isn't your everyday massage. It requires specific motions on the wrist and forearm that over time will drain excess fluid, break up adhesions, and enlarge the carpal tunnel. This reduces inflammation, thus alleviating carpal tunnel syndrome. So as you see, you don't need surgery to treat your carpal tunnel syndrome. Instead, professional deep tissue massage applied daily will be nearly 100% effective in alleviating your symptoms. To get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.